Hey guys, it's Alexis Nicole. Welcome back to the Nurse Nook. So I wanted to do a video on, is it beneficial to become a CNA before nursing school? I've gotten this question a few times on my channel and I finally wanted to make a video on it because I think it's a really important question. So is it beneficial to become a CNA before nursing school? Absolutely yes. But do you have to become a CNA before going to nursing school? Absolutely not. It is perfectly okay to go into nursing school with absolutely no medical background, because I had absolutely no medical background whatsoever going into nursing school. I literally just dived headfirst and was shocked because I had no idea what the medical field was like. Barely ever been in a hospital. No, just clueless. So for people that are thinking about going to nursing school, thinking about becoming nurses, I would encourage you to become CNAs before going to nursing school. I'm not saying you have to, but I'm saying it's a good experience to become a CNA before, so that you can kind of get the feel of the hospital and kind of know what you're doing in a medical setting. So I have a list of a few benefits on becoming a CNA. My number one benefit to being a CNA before nursing school is the patient experience interaction you get. When you're in nursing school, the first semester or two is just like books, textbooks, lecture, whatever. You don't really get that patient interaction experience. And even when you do start clinicals, it's kind of nerve-wracking and you feel uncomfortable, like you're a student, like should you even be in here, and you're trying to talk to the patient and it's just weird and awkward. So being a CNA does kind of help you, interact with patients, get used to that patient interaction experience, especially when they're in a time like they are in now in the hospital or in a long-term care facility or assisted living facility. You get that interaction with sick patients. Another benefit is the hospital experience you get in interacting with the healthcare team. Sometimes it's a little bit intimidating to interact with physicians or nurses or charge nurses, and you feel so inferior and like you don't belong there. But being in the hospital, again, gives you that little bit of experience to where you're comfortable around the healthcare team and to where you can talk to them and not feel like you know nothing. I just think it helps with all of that. Another benefit to being a CNA before nursing school is you can see firsthand the disease processes you're learning in nursing school. A lot of times we'll read about things, textbook, whatever, but when you see it in person in a patient, it's totally different than what you expected. And you can kind of correlate, like, oh, I remember learning this in nursing school. I remember colostomy bags, and here is a colostomy right in front of me. So that piece, you can kind of like, it helps you connect the dots, and you kind of recall when you're learning about things like, oh, I've seen that before. I know what that looks like. Another one of my most important favorite benefit to being a CNA is you kind of get to shadow the nurse while you're working as a CNA. I know when I work, I kind of, there's some blood pressure or something will be off with my patient, and I'll call the nurse and I can see her interventions, what she's doing to the patient. It's like real life hands-on experience. You're shadowing without being in the clinical setting. You're working, but you can also see that aspect of the care the nurse gives the patient and what her interventions are, how she greets herself, how she handles her patient load. You can see all these things while you're still working. So how do you become a CNA? Typically, there's like a course you have to take a couple weeks long. It's a couple $100, and then you sit for your licensure exam, and then you get licensed, and then you can start working as a CNA. How I did it is I don't have my CNA license, but the reason I got hired was because I had already had 2 semesters of nursing school, and that's like equivalent to the CNA license, so that's why the hospital hired me. I did not have experience before nursing school in the hospital. I only started after I was already 2 semesters in. So prior to that, I had no medical experience whatsoever. But after being a CNA and while I'm in school and a tech at the same time, I start to connect the dots a little bit more. I can see what I learn in the classroom and I see in a patient, like, oh, I see how that works. So I love being a CNA for that reason, because I can connect the dots and everything just forms this big picture, like when you're in nursing school, you get all these little puzzle pieces, and the whole time you're just like trying to connect the pieces. And I feel like CNA helps connect the pieces a little bit faster. So by no means do you have to be a CNA before nursing school, but it is beneficial to you as a student. So if you have the opportunity to, I would suggest it, but you do not have to do it. Trust me, I had no experience before, even being a CNA during nursing school. Like finding a job when you're halfway through nursing school helps, because even when you're applying for jobs later on, they say, oh, like she already has hospital experience, blah, blah, blah. And you want to build that resume as much as you can, because you're going to be graduating with all these students and you have to compete against everyone. So anything you can to make your resume look A1, do it. So anyways, that's the end of my video, guys. Let me know down below if you have any suggestions for other videos that you guys want to see. If you're not already subscribed, please do so. I put out new videos every week. Thank you guys for watching.